Hi guys, I am Dr. Shannon Clark with Babies After 35, and we are going to talk today about sex after baby. As always, if you guys are having any trouble hearing myself or my guest who will join us here in a little bit, let me know. Put it in the comments and I can see. We should both be wearing headphones. Here she goes. So we're waiting for her to join.
Hey.
Hi there, how are you?
I'm well. How are you?
I'm doing wonderful. I'm super excited to be joining you today.
Well, I'm excited to join you.
Yeah, I watch you on Instagram and I think you're super cool and I love what you're doing.
Thank you.
And I'm going to ask you to explain to the audience, but first I want to introduce you. Of course, I'm Dr. Shannon Clark with Babies After 35, and this is Dr. Juan Michelle Martin of At the Pelvic Perspective. And I'm actually really getting into this whole pelvic health, pelvic floor PT thing, which after 20 years of obstetrics, you would think it's about time. But it is kind of a new field. Tell everybody kind of what you do and how did you get to be interested in this as a physical therapist and a doctor of physical therapy?
Sure. Well, first of all, thank you for having me. I'm Dr. J. I go by Dr. J.
Dr. J, okay.
And I'm the owner of Shannon M Health Solutions in Atlanta. I've been practicing about 13 years, and I started off primarily in orthopedics, but I worked with a lot of pregnant and postpartum women. And oftentimes there just wasn't a lot of information that these women were receiving. As I transitioned to another practice, I was working next to a trauma surgeon, so I was seeing a different side of pelvic health, pelvic trauma. But again, with these women, you know, they're coming from the trauma surgeon who's suturing up. His job is to keep them alive. Yeah. And that's pretty much it. So really throughout, you know, along the way, women or men for that matter, weren't getting a lot of information with regards to this portion of the body. Then I had my own kids, and it was like, that's usually how it happens. And even though I knew a lot, you know, I wasn't surprised when after my daughter was born, I had a little bit of soreness. I had a little bit of leaking initially, but I knew what to do to address that. No information was given to me with regards to anything, you know, what to expect, what could happen, anything of that sort. And I thought, well, if I'm, you know, knowledgeable about this and I'm not getting any information from them, what's happening to the other women out there who just have absolutely no clue?
Right. And I'll just go over quickly kind of about what happens in a nutshell with what can happen with the pelvis. So, you know, I did a talk about a month or so ago about obstetrical lacerations, and if you guys want to see the actual anatomy specifically, I did that discussion then about the anatomy specifically. But in the pelvis, there's a sling of muscles that kind of support, you know, your bony structure of your pelvis. That sling of muscles kind of fills that open space. And through that sling of muscles goes the rectum, the vagina, and the urethra. So when you're pregnant, and even just carrying a baby, even if you had a cesarean section, if you've carried a baby, all that pressure from the pregnancy and having one or more babies can cause that pelvic floor to become damaged, or the muscle can be distressed, or, you know, that's where you hear about leakage of urine or having a fecal or urine incontinence. Those are probably the most common things that women hear about. But then if you also deliver a baby vaginally, that's extra strain and stretch and pull and on those muscles. But then you also have to think about the bony structure as well. And the main joints would be the sacroiliac joints in the back and the suprapubic one in the front. And that kind of summarizes it. So all of those, oh, there you go. Yeah,
there you go.
Yeah, sure. Show us exactly what I'm talking about. Yeah, there you go.
So we've got the muscles here, and that's the pelvic floor. So they run from the tailbone all the way to the pubic bone in the front, and you've got multiple layers, and they support these organs. So you've got your rectum, you've got your uterus, and you've got your bladder that kind of sit in here like this, and they're supported by those muscles. Just for a visual in case.
That's perfect. And then also show them the joints, the joints as well, the bony structure. So
then you've got your pubic bone in the front, and this is the pubic symphysis, which is a site of a lot of pain for a lot of women. And then right here at the bottom of the lumbar, so this is your fifth lumbar vertebrae, and then this is the sacrum. And so these would be the SI joints here, the joint formed by the sacrum, and then the ilium. And so that's another site of pain for a lot of women during pregnancy.
Yeah. So if you think about it, if you're carrying a baby, and again, I know when I was first coming through, and I've been doing obstetrics for 20 years, we thought it was mainly the pelvic floor dysfunction could come from just pushing a baby out. But now we know that it could just be even women who have had cesareans and didn't deliver vaginally can have it as well. It's multiple pregnancies, carrying a large baby can also cause pelvic floor dysfunction. So that's important to know. And I do think, and you can add that, I feel like with the obstetricians, and I'm one, we don't get a whole lot of training on that. So when we have women coming in, especially during pregnancy and shortly thereafter, we attribute a lot of their pain and discomfort just, oh, you're just pregnant. Right. And so I do feel that, you know, sending them to someone such as yourself is highly underutilized. So can you talk about specifically what is and I've talked about this a lot on social media, what is a pelvic floor or pelvic health PT? What is it that you guys do?
So I tell everybody, we specialize in everything between your belly button and your knees, because your pelvis is such an interesting area. Yeah. You've got your spine here. This is where your hip actually attaches. So you've got your hip joint right here. The groin is right in through here. And so it is the intersection of a whole lot of muscles, a whole lot of nerves. There's a whole lot going on that we oftentimes just dismiss. So we're looking not only at the pelvic floor itself, but we're looking at the joint. So the musculoskeletal structure, we're looking at the nerves, what is happening in there. You know, during pregnancy, a lot of women might complain, oh, I think I've got sciatica. And there could be a whole ton of other neurological issues that are happening as a result of the pressure, changes in posture, alignment, and so on. We've got tissue changes. We've got a whole bunch of muscles in there. So we're, you know, not just your pelvic floor, your lumbar muscles, your abdominal muscles, the glutes, the hip muscles, the adductors. I mean, there's a whole heck of a lot going on in there. So we look at addressing any pain, any discomfort. We look at the function of the organs, so the bladder, the bowels. We look at pregnancy, postpartum, any of the connective tissues. I mean, the whole gamut. I have a friend that says, you know, we just specialize in the 6 Ps: pee, poop, pain, preconception, pregnancy, and postpartum. 6 Ps.
That's perfect. That is perfect, actually. And that's a great summary. I wanted to talk about that because I do think it is an amazing field, and I do think it's something that as obstetricians we need to be more familiar with and have you guys on speed dial for our patients. And I see more and more, especially on social media, of persons such as yourself who are coming forward and educating women that, hey, we're here. And so I just want to put that out there. They're there. And, you know, even if you're pregnant and you're having issues, great resource. And physical therapy can help. There are things that we can do for you guys that are having suprapubic or symphysis pubis diastasis, pelvic girdle pain, other things that happen in pregnancy. We're going to talk about sex, but I just wanted to put that out there that there are a lot of things that doctors such as Dr. J can help you guys with. So moving on to while we're here, one of the things that I wanted to just touch on is since sex is going to occur after baby, it's occurring in what's called the 4th trimester. Now, I always thought there were just 3 trimesters. So what is all this about the 4th trimester?
So the 4th trimester is the 13 weeks, because the trimesters kind of go in 13-week periods. So it's just the 13 weeks or the 3 months that occur immediately after the baby is born. It's a time that's characterized by a lot of change. We have changes in hormones. We have changes in your body, physical state. You know, women will lose weight. You know, just the dynamics, the structure changes. We have changes in tissue integrity because we've had this baby. We've had a lot of stretching. We might have had some trauma. We might have had some damage. So there's a lot of changes. There's a lot of healing that's going on. So really, there's just a lot of change. And then we also have to consider the emotional and psychological component. There is a lot going on. So it's just like the other 3 trimesters, it's really a critical time, but often it is just overshadowed by this beautiful new bundle of joy who everybody's really excited about, and then everybody kind of leaves mom to the wayside. So
I think that the acknowledgement and the actual terminology of the 4th trimester is awesome, because that is validating the fact that, yes, of course, everybody wants the baby to be healthy, of course. And it's so stinking cute. Who wouldn't want it? But we still also want mom to be healthy. So we have to remember that she too is going through a new phase in her life, and physically and emotionally, and just as you said. And so the 4th trimester is critical, and we still need to take care of our moms during that period of time, because things can go wrong in the 4th trimester as well. So speaking
Absolutely.
specifically of sex, let's just talk about the physical. What are some of the physical reasons why women may have painful intercourse? Well, let's back up. Generally, after saying having a vaginal delivery, I know what I say as far as what I recommend as far as when to resume sexual activities. Is there a general rule of thumb for when, after a vaginal delivery, a woman should resume sexual activity?
I think there's so much variation.
Yeah.
Typically 6 weeks is what is prescribed by the physicians. But we also have to take into consideration a woman's readiness.
Yep.
We have to take into consideration the level of trauma that she's experienced. And there are some women who may not have had any trauma and who may be feeling fine and certainly resume sex well before the 6 weeks. And that's okay if you feel like you're ready and if there are no physical signs or symptoms. But by the same token, there are a ton of women who might have gone through quite a lot during that birthing process. And one of the things that I always like to add is you have to give yourself some grace. You have to give yourself some time, because if you don't feel like having sex, you shouldn't feel like you're forced into it. You should try to force yourself into it. You also have to consider that when to get help for that in terms of if there is a change in your libido, your desire relative to what your norm was prior to pregnancy and even during pregnancy, and that's just seeming to extend for a long period of time, well beyond a few weeks or a few months, then definitely get help for that. But oftentimes, we're limited in sexual activity based on a lot of the physical changes, and it's mostly the physical changes, the pain. Most people think of perineal trauma, so any of the tears that you might have during pregnancy, but also the physical pain. If you've got a mom that has a pubic symphysis dysfunction, she's not thinking about sex. If she's had SI joint pain, she's not thinking about sex because she's got that pain and certain positions aren't going to be comfortable. And so she's probably like, it might not necessarily hurt to penetrate, but she can't get comfortable, period. And so she's not interested in sex at that point in time.
And so speaking of perineal trauma, as someone who delivers babies, and I will just add that I recently repaired a young lady who had significant trauma from her first delivery. And sometimes, despite best efforts to prevent it, it happens. Sometimes it just happens. And I will definitely say, and I counsel this young lady that she's going to need more than 6 weeks to repair. So I do always encourage every chance I get when I'm talking on live discussions or anything relevant, whenever you deliver a baby vaginally, or even for C-section, but especially vaginally, if you've had stitches and tears there and you're getting sutured up, you need to ask your physician, where did you tear? Where did I tear? I want to know specifically where I tore, what was involved. The most common question I get is how many stitches did I get? No one ever asked me where. And I will just say, we don't put individual stitches. It's a bunch of running stitches that we put in there. The important question is where? How badly? How long do you think I'm going to need to recover? Typically, women are seen within the first 2 weeks, and we assess that area, especially if there's a tear. But some of the worst tears, or the more significant tears, they're going to need to be reevaluated at 6 weeks postpartum as well. So it is so important when you've had a tear vaginally, especially a significant one, that even as obstetricians, we let our patients know how bad it was, how significant it was, how much, we definitely recommend no intercourse for 6 weeks because we want you to heal correctly. And I've seen many women who may not have waited long enough and they come back in with re-injury, and that does happen. And, you could tear in the area between your rectum and your vagina, or the rectum, the vagina and the rectum. You could tear up above around your urethra, around your clitoris, on the vulva. There are many places women can have tears. So it's, there's a lot of places there. So please ask that question. I give a lot of information, so I'll tell you. But
you are a unicorn, because not a lot of women get that. No, and the thing about it with the tears is, women don't even recognize that there could be different types of tears. And so that's something that I go through even before they go into delivery, so that they're aware, if you go into labor and, there is something occurs and you have to get sutured, make sure that you're asking what's happening. Because when we start getting into those perineal lacerations, like you said, there are some that happen, just above here, like the urethra and so on. Most of the time, women will tear here, and they'll tear just right here in the perineum, in the muscle. But then they can start to tear in the muscle closer to the anus, and then they start tearing through the anal sphincter. And oftentimes, those last two, one, they may require more than just a few stitches. Yeah. Two, they're going to require anesthesia. Three, you're going to have a whole heck of a lot more going on, because that's where then you get into maybe some fecal incontinence as well, and things that we typically never talk about in society, because there are a lot of women that don't recognize that there's a lot more leaking that happens than just peeing. You know, so.
Yeah, so be sure to ask. And it's very important. I know a lot of doctors do not offer that information up, and we should. So I try to teach my residents, you guys need to let the patients know, even if they don't ask, let them know exactly where they tore. Anytime you are taking a needle into someone's body, they need to know exactly what you're doing. So we could do a better job of education. I will acknowledge that. So hopefully any doctors that are listening to this, you guys will start doing that. But let's talk specifically, what are some of the physical reasons, other than what we just spoke about, what are some of the physical reasons that could cause a woman to have pain with intercourse, even after what should be her normal healing period?
So if we've got some scar tissue, again, as a result of the healing, some women have a tendency to keloid. That's also something that we need to take into consideration. Pelvic organ prolapse, oftentimes not associated with pain with intercourse. But if you've got, and what a prolapse is when these pelvic floor muscles are weakened so much that they're no longer supporting the organs the way that they should. So now the organs are descending. And it's almost, a lot of women will describe it as a blockage. I feel like there is a blockage. If there's, again, with regards to healing from any type of perineal trauma, if there's significant scarring, there may be some tightness. Because of the pain, women may guard a lot, and that's not uncommon. So now we end up going into a situation where we have some overcompensation and increased tightness of the muscles, which can lend itself to pain as well, and cause, more discomfort. In addition to that, if there's any swelling in the area. So again, everyone heals differently. How swollen are you? Are you still noticing that you're having issues there? If you've had hemorrhoids, because that whole area tends to be irritated. And that's another thing that can cause some pain and some trauma there as well. So those are most of the things that we kind of are aware of. Again, in addition to, are you having any joint pain? Are you having any neurological pain? Sometimes as the baby comes out, there can be some traction, some stretching of the nerves, the pudendal nerve specifically. And so now you've got this neurological pain that maybe, and most of those women tend to have pain even if they're not having intercourse. And so that's going to be another limiting factor. And those are things that you want to have addressed after you've had your baby. So
how long should a woman give herself to heal before she starts thinking, well, maybe, and say she's tried to have intercourse and it's painful, like at what point should she start seeking help or letting someone know, I think something's wrong and I need to be evaluated? Like, what are some of the signs that, it's not just normal healing and I should be healed by now?
I'll say, if you've had, the third or the fourth degree tears, you definitely need to see someone, because there's going to be a lot going on there anyway. I often just recommend go in and at least have a consult with a physical therapist, a pelvic floor physical therapist. But if you've had sex and it's painful, you've had a seemingly, trauma-free birth, because sometimes, there's just not a lot that happens in a woman's birth. It's not very eventful. There might not have been any tearing. You might not have been sutured, all that you might not have had pain during your pregnancy. So, we'd be thinking that it should be okay for you to resume intercourse around about that 6-week period. But if you've noticed that you are having some pain, we often recommend to go get that assessed sooner rather than later, because we want to make sure there's nothing else going on. Because if we can go ahead and nip these things in the bud early, the sooner the better. Because the way the body is, the body will try to compensate. You start compensating and then you start feeling more pain or whatever, or you start getting frustrated, things of that sort. And we don't want that. Your sex life should be robust. It should be healthy. So we usually recommend sooner rather than later.
Yeah.
If it is a mom that's breastfeeding, though, we usually will tell them, be mindful of the fact that as you're breastfeeding, your estrogen levels are going to be lower, which are going to lend itself to vaginal dryness. And so with that, make sure that you're lubricating. But if you're finding that you're using a lubricant and that's still not really helping the situation, then definitely go ahead and get that assessed.
Yeah, and I think, and I'll just add that in too. So, you know, the vaginal dryness is one thing. You know, if it's just a matter that there's not enough lubrication and you try the lubrication and it works, great. It might just be because of the vaginal dryness because of breastfeeding, which is very common. But there's also one thing that if you've had perineal trauma and you've torn between the vagina and the rectum, sometimes when it's being put back together right there at the vaginal opening, it could be sewn too tight. And not even intentionally, but just because you're trying to get it together. If you notice that right at penetration, if you notice that's where it's the most painful, is right there as you're trying to have intercourse, that could be the case as well. And that should also be evaluated. And I also want to add that, you know, just like Dr. J said, we should have a robust and a healthy sex life. And if that's what we want. So don't be ashamed and don't be embarrassed to seek help if you're not, because of pain. If you, you know, the earlier the better. And there's nothing wrong with that. No one's going to look at you and be like, okay, no, we should be there to help you. And if anybody does that, go find somebody else. But, you know, it is okay to talk these things about your doctor. It's okay to ask, hey, do you know a pelvic floor PT that I can go see? You know, of course, they will check your bottom and make sure that the tear's healed correctly, and then say, you know what, maybe you should see someone like Dr. J to start some kind of treatment plan. So please don't be embarrassed to do so. But speaking of treatment plan, once they say they've gotten cleared and there's nothing significantly wrong with the tear's healed, there could be a little bit of SI joint or suprapubic joint issues, or maybe a little pelvic instability. When they come to see you, what do? How do you start your evaluation? What is it that you'll do?
I start my evaluation by getting a thorough history. I need to know what happened during your pregnancy. I need to know if there was anything significant going on even prior to your pregnancy, because oftentimes we leave that stuff out and it can really paint a great picture of what's happening. Beyond that, I also want to know what that birth was like. You know, how long were you going through birth? Because if that second stage of labor is very long, we're going to have some problems. So it may be that it didn't result in tearing, but you have to figure if you've just got a baby that's coming down that passage and just coming down, and we're really not having any changes being made, that's still a lot of stress to those tissues in that area. So we do a thorough assessment in terms of what's going on physically. We also then go ahead and look at the muscles. What are these muscles doing? The pelvic floor muscles should be able to contract. They should be able to relax. They should be able to lengthen. Are they doing that? Do they have good endurance? You know, can they engage? Can you consciously engage them? Can you consciously relax them? They should be able to do that. They also should be able to act reflexively. And so we've got to make sure that the muscles are functioning in that way, and they're functioning the way that they need to be. Also, I want to see how you're doing things that you normally would do. Can you transfer well? You know, is your pain, you know, increased with transferring, getting up from a chair, turning onto your side in bed, general movement, walking, those types of things? Are you having heaviness? Are you having those symptoms of, you know, abdominal pressure, pelvic pressure? Because that would be the prolapse coming in. So we try to look at all those things to see what's going on. And then based on what we're seeing, then we can create a plan of care specific to those individuals. Because everyone is going to be different. And I know most people go, well, how long is it going to take me? And that we don't know until we've been able to assess you.
Yeah, and sometimes you'll find, you know, all of that kind of works in together. If you're having some prolapse and you may even be having some urinary leakage along with it and the painful intercourse, all of that could be kind of addressed with some pelvic floor PT by helping to strengthen those muscles and also get your pelvic bones more secure and stable. So, you know, are there any kind of specific exercise regimens? Do you come up with a treatment plan? Do you, you know, what is a typical treatment plan? What would that look like? And the reason why I want to kind of dig into that a little bit deeper is because I want women to understand that this is just as much as if you had diabetes and you needed to go get your sugars checked every week, or you had high blood pressure, and taking care of your pelvic floor and your pelvic, you know, like you said, from your belly button to your knees, because if you're having a dysfunctional pelvis in the muscles or in the bony structures, that can affect the way you walk, the way you sit, the way you turn over in bed. And you might even not even think that it's your pelvic floor that's causing this. You might think it's your hip, but actually it came because of your pelvic dysfunction.
Because of the pelvic floor issues.
So, you know, that's what I'm trying to get at. I'm trying to want to get to across to women that all of these things can be intertwined and connected.
So if women are having weakness, and this is the reason for the assessment, because you could be having symptoms for more than one reason.
Yes.
If the cause of your symptoms, your issues is weakness, then we work on strengthening. And I know everybody is familiar with the term Kegels, but Kegels are just one part of the puzzle. They're not the end all be all. And quite frankly, you know, you have an exercise where it's just a static exercise, and we are dynamic people. We move. We're not sitting down, laying down all day going, okay, now I got to do my Kegels. You know, we have to look at things that translate into your normal daily function. And that's the goal for what we do. So we're working on strengthening. We're going to work on strengthening of the pelvic floor. How can we make that pelvic floor more dynamic? How can we get it to where if you are a mom who doesn't want to leak when you're lifting your baby, we can do things that translate to that. So we're looking at functional type exercises where we can start to incorporate the pelvic floor as well to address the issues. If you're an athlete, and I work with a lot of athletes, you know, and you're going back into your sport, what does that look like? We need to make sure that your strengthening program is dynamic and can accommodate the activities that you're doing. But by the same token, if because of the scar tissue, if because of the trauma, the opposite is happening and we've got a significant amount of tightness, we've got to look not only at the pelvic floor muscles, but we've got to look at the surrounding muscles to see if they're also affected too. Are your adductors really tight? Are your glutes tight? Are those muscles, those bigger muscles, firing the way that they need to? So it's more than just the pelvic floor muscles by themselves, because as everything is working, when it's working well in that area, it's almost a symphony. The pelvic floor muscles fire to stabilize the pelvis, then the other muscles start to engage so that you can move or react or whatever have you. So it's more like they start first and then everybody else chimes in, but we have to make sure that pattern, that coordination is happening the way that it needs to be. Then again, that pretty much starts with a thorough evaluation so that we know specifically what is happening.
And and how this all relates to sex, because I know we haven't talked about sex specifically, but it all relates to sex, and I'll give an example. If I have a woman, even if she has an epidural, and she's not feeling any real pain, sometimes if I go to check her cervix, her muscles, just anticipating it, that's what I'm doing, her muscles will go and tighten up. Okay, not because I'm hurting her, just because she knows what I'm about ready to do, and it's just kind of reflex and anticipation. So if you think about it, if you're postpartum and you're trying to have intercourse and you're either afraid of the pain or you do have the physical pain, and all those muscles are either already tight or tighten even more, that's not going to make sex very enjoyable. So it's kind of like the mind-body connection, mind-pelvis connection in a way, you know, to kind of get everything working in symphony, so that we can make sex more enjoyable for you. So that's where and it is a muscle. The pelvic floor is a muscle. Learning that about yourself and your anatomy, and seeing someone like Dr. J, where she can educate you on that and give you some tips about what you can do. And I was reading your website, and you had some really good tips, and we'll go through those. But that's how this all kind of makes sense. So that's why sex can be uncomfortable after baby, is because of the whole mind pelvis connection, right?
Oh, absolutely. And the thing is, I'll tell people too, like you just mentioned, if you're in pain, you're less inclined to do stuff. You're going to be nervous, and I always mention, like, if you hurt your arm, you're not going to be like, hey, my arm's hurting, and just kind of wave it out here. You're going to keep it clutched. You're going to keep it close to the body. And that's pretty much what happens, if we're hurting. And there are a lot of women who feel, and we can get into a lot of the emotional stuff as well. There are a lot of women who feel obligated. They're like, well, I gotta have sex with my partner because, that's what partners do. And no, because now all you're doing is making stuff worse, because you're in pain, you're hurting, you're clenching, you're in more pain, and that's not enjoyable for you or your partner. And so those are things that we need to be mindful of as well.
Yeah, agreed. So speaking of the tips, one of the things that you had on your website, and which I love, is you said, give yourself grace. What do you mean by that?
Know when you are ready. be okay and know that it is okay if you aren't. Right? You are not, just because other people may say, oh, it's 6 weeks, I'm going back to having sex. If that's not you, that's okay. You're not running somebody else's race, you're running your own. And if you're not ready mentally, if you're exhausted because you've got this new baby and you're tired and you're not sleeping, then you need to recognize that sex is not going to be what's on your mind, nor should it be, right? You've got to get into a place where you're okay with that. Take care of the stuff that you need to take care of first. Get where you need to be emotionally first. And there are a lot of things that can go hand in hand with that. Communicating with your partner, just letting your partner know, listen, I'm not ready yet. It hurts. I'm afraid. I don't want to hurt. Maybe you're tired, you're exhausted. You've this, especially for first time moms, you feel like you have to do it all. Well, girlfriend, you don't. No. You just don't. So understand that, get your rest, take care of baby. These are things that we don't talk about them. And moms just assume that, well, I'm just supposed to jump back on the horse, just like that. Yeah. But know that it's okay if you're not ready. And the other thing is if you find that this is persisting for a long period of time, then find someone that can help you, whether it's a pelvic floor therapist, if it's more emotionally related, find a great sex therapist. There are lots of those out there, a sex counselor that can help you with that, with just kind of, figuring out those feelings and trying to get back into the game, get back into action with that.
Okay. And the next thing you had was make time. Sometimes you just might have to plan that rendezvous.
Yeah, so sometimes, you got kids. I've got 2 little kids, right? And so it's hard when you got 2 little ones. It's like, oh, the kids are sleeping, let's go. And then one wakes up. Or you can only get one to sleep and, your best made plans don't come through. But you've got to make time. Maybe it's an afternoon date if it's possible. Maybe it's, getting those kids to bed even earlier. Maybe it's hiring a babysitter. Maybe it's, I don't know, maybe it's getting, somebody to come over, family member to come over and watch the kids, whatever it is, but start making time for you to start rekindling some intimacy in your relationship. And intimacy doesn't necessarily mean sex. Yeah. And when I say sex, penetration, intimacy can just be spending that time so you can start bonding again, right? Because that's just as important. And, make time to just be together. So sometimes you just got to plan some stuff out. Sometimes you might have to, my husband and I used to joke because I would say, you know what, let's go to the grocery store together. And he was like, yeah. I'm like, I'm leaving work early. You want to go to the grocery store? And he's like, okay. And the grocery store became our code word for, let's just go. We're going grocery shopping. And the kids are like, Mommy, where are you going? We're going to the grocery store. But you got to do what you got to do.
Yeah. No, you definitely have to make time. And I agree with that. And it's hard, especially if you have a bunch of little ones. My twins are 4, but I remember it's, they are preemie twins, and then you're worried about all that. And then the last thing you're thinking about is your partner. And we have to always come back to that because they need us both and we need each other. So it's important to make that time. And then the next thing you had on your list was self-exploration can help. What does that mean?
You cannot expect someone to know what pleases you if you don't know what pleases you. And one of the things that you might find after you've had a baby is that the landscape might change a little bit. But that's okay. I like to term it, you have gone from little girl sex to big girl sex, right? We've gone into like the experience zone of sex, and that's okay. So start getting familiar with yourself. It's also a really good exercise for those who may be having pain. I usually will tell them get a vaginal moisturizer and just start working. Start at the labia, go down to the perineum, then get right at the vaginal opening and start with gentle touch. How does it feel? If there's something that hurts, that's okay. We make a mental note of that, but we start looking at what feels good. And then even adding in sex toys. So get a vibrator. How does that feel? Start some clitoral stimulation. Once you've gotten comfortable with that and you start to get, become more aware of what feels good, bring your partner on board. So I like to recommend to my clients all the time, non-penetrative intercourse, where you get to play around with the landscape. You invite your partner to play around with the landscape. And it's kind of, I liken it to 2 giddy-headed teenagers, just like, ooh, I want to kiss you. Ooh, I want to kiss you back. That kind of thing. But it can become a fun experience for you and your partner. It takes the pressure off because now you're not thinking about penetration, right? Especially if that's something that's painful. Now we're starting to explore other acts that are pleasurable, equally and sometimes even more pleasurable with your spouse. And so that can be a nice, fun thing for partners to do.
And then lastly, you had nutrition. How is nutrition going to play a role?
So I tell people all the time, you are what you eat. And we want to make sure that we are eating to sustain healing, just in general as a postpartum mom. You know, if you're eating like crap, you can't expect that your body is going to be able to assimilate that and then turn around and heal well. So you want to make sure that you're eating well, that you're nourishing your body well, because that's going to translate into how your body is also able to heal. That's going to translate in how you feel, you know, whether you're really fatigued all the time or whether you're energized and you feel like robust and like, oh yeah, I could take the world on today. If you're not eating well, you can't expect that your body is going to be able to just keep on going all the time like that. So we want to be mindful of that as well.
Yeah. Is there any role, you know, if a woman has had pelvic floor dysfunction or for whatever reason, and she's seeing you as well, is there any role, and I'm sure that I think I know the answer to this question, but is there any role for being active, exercising, you know, any specific exercises or benefit to cardiovascular exercise, anything like that could also help?
I love exercise, and I tell women all the time to try to find something that they enjoy to do. For one, if you're exercising, you get all those good endorphins in your system. It helps you to feel better in general. I love a lot of mobility exercises, especially early on, because it can help lengthen the muscles, alleviate some of that tightness, especially when we talk about improving and increasing flexibility for the hip muscles, the adductors, the glutes, the quads, the hamstrings. If we can increase flexibility and mobility of those tissues, it decreases the amount of tightness in that area. So by extension, it also helps to decrease some of that tightness in and through the pelvic floor. So you definitely want to participate in, you know, good mobility exercises. Yoga is great, and it also helps with good breathing. Some Pilates where you can be more mindful of your movements. I don't necessarily advocate, especially for women who might have had a lot of trauma. We're definitely not thinking heavy strengthening or anything like that. But especially early on, we're just thinking movement-based exercises. Also walking, you know. I tell people I love dancing because especially salsa dancing, there's a lot of hip movement. And that can be another good exercise for you to kind of get things to loosen up a little bit as well.
Yeah, I mean, I think it's kind of a whole mind pelvis approach, mind body approach when it comes to that. I think it's something that we don't pay enough attention to for women. We just kind of expect women to be superheroes after they've given birth, and we are in many ways, but we also need to be taken care of. So I am glad that I had this conversation with you, because even though it was about sex and how to make sex better, you know, having a healthy body is important. And I'll just use myself as an example. I was on hospital bed rest for 2 months before I had my twins, and I didn't have them vaginally. I had a C-section. But to this day, I still have a lot of lower back, hip, all of that pain, largely because I haven't addressed it. I'm a busy doctor, and you know, the last thing I know, I drive an hour to and from work, and I'm suffering the consequences of it. And it's something that I'm trying to do a better job at, but I know that all of that's interconnected, and we have to take care of it, because when you're having chronic pain for lower back pain and pelvic pain and all that, you know, that can affect your mental, you know, wellness, your emotional wellness. And so it's very important. You know, pregnancy is hard on a body. It's not easy. Even though you could have a beautiful pregnancy and be perfectly fine, it still takes a toll on a woman's body. So we have to take care of our body. Would you agree?
I absolutely agree. And I think moms, you know, and going back to the giving yourself grace bit, you know, we understand as moms that there's a lot to do. You know, our attention is pulled in many different directions. But I usually will have my moms do some journaling as well, and start to focusing on, okay, we need to pick the things that are most important to you. You know, how much, and I always ask them, how much is this pain affecting your life? How much is this affecting your life? How much is your inability to have sex affecting your life? If that's not a priority, I already know that you're probably going to be taken away because of other things going on. And that's okay. Let's address those things that are primary, and then let's get back to addressing this, because we also need to address it. Like you said, you can have back pain because the muscles, the core structure is not all working in concert. And so we need to make sure that we're taking care of that, because if not, then fast forward, we think 5 years down the road, 10 years down the road, then these problems are still going to be there. Yeah. And for some people, they may be worse. So we definitely need to make sure that we're at least taking care of them.
Yeah. And I'm a prime example of that. I put too much time in getting back to work and not enough on myself. And it's been 4 years, and it's time. And I'm slowly getting back to doing that. But I could definitely see, and maybe it's part of the reason why I'm so interested in this topic now, is my own personal experience from it. And again, I didn't have babies vaginally, but just having the carrying twins and having the hospital bed rest, which does a number on your musculature, for sure. I mean, sometimes I'll walk and it just, my hip grabs, or I turn around and I turn in bed the wrong way. And I know it's all connected, but I'm so stubborn, but one day I'll be better. I wish it was in Atlanta. I'd come see.
I do virtual.
Yeah. No, okay. Well, that's right. Okay. So let's talk about, how can people find you? Let's talk about on Instagram. How can they find you?
So on Instagram, I'm at The Pelvic Perspective. You can shoot me a DM if you have questions. I always tell people, just know that if you're sending a question, I can't give you a specific answer if I haven't evaluated you. So just be mindful of that. But you can find me. You can ask me general questions on Instagram. You can go to the website, jmmhealthsolutions.com. You can schedule appointments there as well. And I also do virtual. I'm licensed in Georgia, New York, and Florida. So if you're in those states, I can absolutely treat you. If you're not in those states, I can absolutely refer you to someone who is in your state that can help you.
Oh, can you tell what specifically can you do virtually? Like what are the services that you do offer on your website if they go to your website?
Yeah, so I see men, women, and children for pretty much anything. I work with women pre, during, and post pregnancy. I work with people with chronic pelvic pain, issues with sex, urinary bowel issues, athletes with trying to return to sport, or address any of these issues that may be occurring as they train, any persistent back and hip pain as well. Virtually, we can still do a whole lot. And I think a lot of people think because your hands are not on them that you can't do a lot. But I sometimes love virtual more than in person, because it helps to empower people a little bit more. It helps to put the onus on them a little bit more. And it's a great way for me to help encourage my clients to do a little bit more of that self-exploration. So I actually guide them through how to do that assessment. I guide them through how to focus in on the things that are going to be necessary. And then we start working on whether it's the strengthening, the coordination, the relaxation, the exercises, those types of things, strategies, whatever have you. There are a lot of things that we can do. I mean, if it's a person with pain, we can talk about even using dilators. We can go through a lot of the different products that can be helpful. And this is the same in person. Using the pelvic wand, if necessary, for some myofascial release. And I'll usually have my clients use this on their own as well. So there are a lot of things that we do and that we can recommend, for a lot of people who may be having issues. I just had a client of mine she's not local, but she contacted me because she was having pain with sex. And this is a menopausal client. And, there was no one in her immediate area. And, we were able to get that under control in about 4 sessions, just making sure that she had the guidance, she had the tools to use. We talked through, things that I needed her to do, made recommendations for some of these products as well. So there's quite a lot that can be done. Even in the virtual setting.
Yeah, that's really, really cool. So I go find Dr. J. As you can tell, she's very knowledgeable about this topic. I wanted to bring attention to it because I do think that we do need to talk about it more. And I am very, very grateful that we have people such as Dr. J who are on social media and kind of breaking, because in some ways it's a little taboo because women don't want to talk about it, and they think they should be okay to have sex, or they should be feeling a certain way. And sometimes you just don't. And it's okay to not. It's also okay to find help and seek help to get answers. The longer you wait, and then you have another baby, and then it gets worse. And then, it gets compounded. Start early if you think you're having issues. Get an evaluation early. is there any kind of resource out there to find where you have pelvic floor PTs specifically? I know anybody can go find a PT, but how?
So you can go on the pelvicguru.com has a directory.
Okay.
The American Physical Therapy Association has a directory.
Okay.
Herman and Wallace has a directory also. I believe it is pelvictherapy.com.
Okay.
But there are directories out there. You can also just do a Google search in your area to see if there's a therapist near you as well. And there are tons of us on social media, so you can always just reach out to someone and say, hey, do you I'm located here. Do you know somebody?
Yeah, great. So I appreciate your time on this a holiday weekend. It's not a holiday for me. I'm actually on call on Monday, so I'll be working for 36 hours. But I hope you get to have fun this weekend, and it looks like it's going to be a beautiful day in Texas. So I'm going to go enjoy the rest of the day. But thank you for this.
All the cool people are in Texas.
Well, Texas is it's a big state, so there's a lot of us here. I'm from Kentucky originally, but I've been here since 2004 or so. Yeah.
It's like all the cool people are over there. I missed the memo.
We might snatch you up. But Atlanta's pretty cool too, though. Atlanta's pretty cool.
It is. It's growing on me.
Yeah,
I moved here from New York.
Oh, you did? How'd you end up in Atlanta?
I moved for another position.
Yeah, cool.
Yeah.
No, there's actually really cool people in Atlanta too. So.
Yeah.
All right. But anyway, thank you for your time. And I really appreciate your information. Please go find Dr. J at The Pelvic Perspective on Instagram. This video will be available on my Instagram feed, my Instagram stories, and also on my YouTube channel, but I'll direct you to all of that. So if you guys have any questions, you can direct message myself or Dr. J. And again, we can only give general answers, but we'll try to get you the answer that you're seeking. So I appreciate your time. I hope you have a good rest of your weekend.
Thank you. You too. Take care.
Bye-bye.
Bye.